Do not go to a hustler for your health care. Do not go to a hustler for your health care. For you, your well being is at stake, your life is at risk. And for them, they may not have anything to lose. Okay. What they're doing to you could very well be illegal, where they're not reporting to a board. They have nothing to lose. They're just taking a chance on you, risking your health care just to make money. For them, it's about money. At the end of the day, it's about money. Even if you listen to the way some of these scammer professionals speak, you can hear that it's always bottom line about the money for them. What am I talking about? I'm referring to these veneer techs, these veneer technicians, these lash techs that don't know what they're doing, these people that are administering lip fillers, illegal injections, lip fillers, providing illegal Botox injections, providing illegal BBL services, doing having hosting pumping parties where just a lot of people just coming in and getting illegal cosmetic procedures done for a discounted rate, or just to have access to it, because these procedures are very expensive, and that's why the people with a lot of money are able to get them so easily, because they have that resource that a lot of people who resort to these profession or these people, okay, do not have. And it's very sad that it's taking out our people, and not just our people, but our specifically our women, our young women, our impressionable young women that look to these celebrities, that look to these influencers that are promoting services that they just got for free. Okay, it doesn't matter to them like how anyone else is impacted negatively or otherwise, because for them it was always about the sponsorship, it was always about the money, it was always about the promotion and things like that. So I just want to remind you to not go to a hustler for your health care. For them, it's only about money. For you, it's your well being. Like, yes, you're cutting corners at the beginning, but what about if the procedure is botched? Okay, for procedures to go botched is very common. It doesn't matter what procedure or surgery it is, it absolutely can come out to be botched. All right, so what about the money and the time and the pain and suffering that if this procedure is unsuccessful, that you will have to deal with the botched consequences and the cost? Conan, stop. Um, Veneer techs. Okay, so like with the shutdown 4 years ago, it brought out a lot of hustlers. Okay, it brought out a lot of people teaching BS courses, teaching people how to pretty much get money by providing the very thing that people want. Okay, so veneer techs, prime example. First of all, they are illegal. Only dentists can do what veneer techs claim that they can do. Okay, so by definition, veneer techs are people, not even professionals, people who illegally place veneers on patients after completing a 2 day training course. 2 day training course. Okay, even dentists go to school and acquire education for years on the collegiate level. But you mean to tell me you're going to trust somebody that took a 2 day course? And they didn't take the course because they wanted to be a veneer tech. They're taking the course because it's easy, because it's only 2 days. Like, someone can decide your oral health care over a period of a weekend. They take a weekend course, and now they're determining the only pair of teeth you have for the rest of your life. Shaving down your natural teeth that you already have, shaving it down just to make it look aesthetically pleasing. And most times these veneers don't even look good. It look like chiclets. It look like white squares on your teeth. It looks fake. It looks big. It looks exaggerated. It looks bad. But now you're stuck with them, unless they fall out. But anyway, veneer techs are people who illegally place veneers on patients after completing a 2 day training course that typically costs around $2,000 to $3,000. Okay, so their investment is less than $5,000, and they're gonna be playing with your mouth, the thing you use to communicate with, the thing you use to digest food, right? Your sense of freedom is your voice, your mouth, your smile, okay? If someone messes up your teeth, it's going to affect your ability or desire to smile. And you're gonna leave that up to somebody that just decided to take a 2 day course for less than $5,000, where they're people's life is at stake. Like if you mess up something in your mouth with like hit the right nerve, or have like severe injury and disease and decay in the mouth. Like that's the thing, veneer techs, they're not even cleaning your regular teeth. Some veneer techs are seeing the patients with missing teeth, decaying teeth, cavities, and they're placing the veneers right on top of it. They're not even caring to get to the root of the issue. And that's a sign right there. That's a red flag, you guys. Like they should care about cleaning your teeth, preserving the teeth that you have, not just saying, oh, let's just shave it down even more. Because like when these veneers have negative outcomes, I've seen TikToks and seen videos where people are going back to the veneer techs, and their fix is to just shave it down even more and do it again, try it again. After which these techs receive certificates of completion that do not certify them to perform dental work. Veneer techs are not certified to perform dental work, even placing veneers on your teeth, okay? Please send this to a person that is considering it. These impressionable young people, they're not doing their research. So the people that have sense, we have to, spread this information to them to let them know. Don't go to a hustler for your health care, all right? These women's going to have procedures done on their bodies, breast augmentations, BBLs, Brazilian butt lift, ab sculpting, air sculpting, whatever that's called. Getting lip fillers. You've seen the videos and the pictures of women with, the before picture, and then you see these very exaggerated, scary, clownish even lips. And it's distorted because there was a reaction in the body. The procedure was not done correctly. And so now, when they had a fine smile, I'm sure, but their insecurities got the best of them to where they felt like, even if it's not up to standard, even if it's not up to par, even if there is high risk associated with me doing this procedure with this person in this setting at this time at this cost, despite all that, I'm going to choose to go through with this because I need this, And now these people that have entrusted these people, all right, entrusting these people with their health care, with their body, okay, even if it is a cosmetic procedure, which is elective, which is optional, which you don't have to get it. It's not life or death. It's just you choosing. You want to elevate your appearance. You want to elevate your beauty, and you feel that taking this route of doing these procedures is going to get you there. So now you're trying to save money on the front end by getting it cheaper, getting it done in countries where it's illegal, getting it done in spaces where it's not clean, where the person that's doing the procedure isn't a professional. They're not doing a health assessment on you. Just like when they place those veneers on unhealthy teeth, they're not doing a health assessment. They're not assessing your health to see, is it even safe? Why are you going to a scammer, a hustler, on your body's safety, on your physical body? You're entrusting them to either help you or hurt you. There's only two options out of this. It's either hurting or helping me, So really consider who you are allowing to do long-term procedures on your body. Lip fillers, Botox injections. With Botox in general, even if you get the most legal and expensive Botox, it doesn't last forever. You eventually have to keep getting it. So before you even go get these procedures, consider the maintenance. All plastic surgery require maintenance. Even if you get breast implants, about 15, 20 years later, you're going to want to do something with those implants. They either have to be removed because there's probably been a recall by then, or they're starting to sag. Mother Nature, gravity is taking hold, and it's pulling the breast down to an undesirable in an undesirable way, and the patient usually decides to go back for a second breast surgery, a second breast lift, a second breast augmentation, a second breast implant. Sometimes they want to go bigger, sometimes they want to go smaller. Maybe the first time they went too big and now they got to reduce in size. We see this all the time with people that get breast implants. They either went too big the first time, or they went the large size that they wanted, but now their lifestyle choices have changed. Now they want to look a way that doesn't include these exaggerated breasts, so they may choose or decide to have the breast implants removed. Or maybe the first time they got the breast implants done, it was fitting their body, but now they want the boobs bigger for whatever reason. So in most cases, you're going to have some type of upkeep, maintenance, and with that, that's time to schedule it, okay? Finding the procedure, the doctor, scheduling it, having the procedure done, the pain and suffering during the procedure, the pain and suffering during the recovery, the physical therapy that has to be done with the recovery, okay? Going back and forth to these appointments for physical therapy to be checked up, having these checkups and stuff. The amending your space, your environment, purchasing the furniture and purchasing the supplies that will help assist and aid in your recovery. How people buy the electric chair so that instead of having to walk the steps, they could just sit on the little wheelchair and it just takes them up, stuff like that. Having to purchase a larger flight seat because flying back on the plane, it's going to be uncomfortable, so now you have to accommodate for that. The embarrassment of having a botched surgery and going public with it and sharing your story. Yes, it could be healing and helpful for you and help someone else, but at the same time you also have the option to choose to not do that thing knowing it was so risky. So I just want to encourage all of us to do more research before we pull the trigger on things that are elective, that don't have to be decided right now, especially when it's regarding your life, your health care, your peace of mind, your mental state. Because I can't imagine the depression, the anxiety, the insecurity, the body dysmorphia that forms when people experience a botched procedure that was elective, that was by choice. So now they have to go through life constantly making peace with those choices. So I want to encourage you, maybe before doing a long-term procedure on your body that is mostly motivated by society's beauty standards, the opinions of other people, the opinions of other people that don't even like you, the opinions of people that you don't even like, the opinions of people that have a life that you don't even want. So it's like, why are you even listening to them and taking their advice and taking their judgment? So really consider your spirit, protecting your energy, protecting your mindset, constantly speaking positive affirmations over your body, over who you are, and making peace with who you are, and not allowing these corporations that are only concerned about money, these people that taking 2-day courses for less than $5,000 and playing with your health, playing with your eyesight. Okay, these lash techs, there's so many different variations of lash techs out here. I've heard they do clusters and clumps and then individual lashes and just all these things I've seen now where they're using some type of UV light, like the same light you use to get gel nails. They're using that per lash for these women. So now it's blindness at risk, all because you want longer lashes. Just get some freaking mascara and call it a day, And again, with these lash techs, I didn't have the information pulled up here, but their turnaround time in regards to education as well is just as quick as the veneer techs. Lash tech, veneer tech, they seen it as just sticking it on. Oh, we're just sticking it on your eye. What about possible infection? What about possible blindness? What about possible injury? You poking my eye, you know what I'm saying? So cutting, slicing my eye. What about that? What about, just you're in that vulnerable position for somebody that's just there, not because they have a passion for beauty, not because they have a passion for helping people, with their lashes and everything, but literally because it was easy and it was quick and it was available and they had the money for it at the time. Like, have more respect for yourself and just not allowing anybody to play with you, just not allowing anybody to have access to you, because they may not even be there with the purest of intention. They may not even be there with the right intention. They may not even really care about your well-being. They may not care about blindness, because I was watching this one video, and the woman was saying, like, yeah, before we do the veneer procedure, they sign this form, and it's basically a waiver saying that the veneer tech is in no way responsible if something goes wrong. So she was just fully convinced that we can't be sued because the patient signs a waiver saying they understand if something bad goes wrong, it's all on them. And it's just like, the point isn't to like avoid being sued. The point is to provide quality service so that people aren't being harmed at your hand. It's getting better so that you don't have people that are having negative outcomes, that are putting their life at risk, that are now in a worse position than when they met you. And that's the thing, like, make sure people have their heart in it when they are involved in your health care and your spiritual care and your mental care. Make sure they're there with the right reasons. Ask people questions. How long have you been in practice? Where did you study? What are your credentials? What is your experience? What have your experiences been like? Why did you get into this field? I try to remember to ask that as often as I can when it comes to, like, choosing the right healthcare professionals and people that you need for professional services. Why did you get into this industry? What brought you here? Are you here because of desperation? You need money? Because you're just going to do whatever. You just want to get me in and out so you can get the next person, right? Or do you care about it because you have an emotional connection to the service, So, be mindful that you have autonomy over your body. You don't have to allow someone to do an invasive procedure on you that could leave you paralyzed, blind, injured, emotionally depressed, or, forming body dysmorphia, forming any other type of mental illnesses. At least seek out ways to heal emotionally first. I want to encourage you to do that. Going to therapy, joining a club, finding a hobby, a passion project, something that makes you feel a sense of joy, makes you feel a sense of love, makes you feel a sense of gratitude. So then that energy of gratitude can spill into how you see yourself, how you feel about yourself, and what you allow to give you power. Are you going to allow the criticism of society, who doesn't even know you exist, doesn't even care about your well-being? Are you going to let what they say decide if you live, or what quality of life you're going to live moving forward? I think it would be much easier to elevate yourself in ways that you still have control. Putting on makeup, styling your hair, changing your wardrobe, getting your nails done. Even, you're allowing someone else to do the service for you. It's just not as invasive. Like, yes, there's risk with getting your nails done, but it's also not as invasive as someone going into your glutes and pumping, or, messing with your face. Like, people messing with your face. So just be mindful of these veneer techs, these lash techs, people that's administering lip fillers, administering illegal Botox injections, doing these illegal BBLs, any type of uncertified, unlicensed board professional, because there's a lot of people that was in practice. They experienced so many malpractice suits to where they're no longer board certified, they're no longer in practice, but they're still doing it in a back alley way. Be mindful that yes, they may be a doctor, yes, they may have had that experience, but their work ethic, they're willing to sneak around and cut corners and use poor quality ingredients in you. They're willing to lie. They're willing, you know what I'm saying? Like, consider the work ethic. And yes, I'm sure there's some unjust board certified people that still help people on the back end, but at the same time, right is right, wrong is wrong. If you know you're not certified to do that, don't present yourself as you are. Point the patient in another direction of a board certified person that could do the right thing the right way. But again, everybody has their price, right? It's always going to come down to money. So please, I urge you, I beg of you, and encourage the young people that are growing up in this impressionable world. We're learning with the industry, it's all about money. It's always been about money, and people are realizing that. So please just continue to speak life into these people that are willing to put their life at risk, all because of these horrific beauty standards. Okay, do not go to a hustler for your health care. This has been Chi Chi. Thank you so much for tuning in. Please give this video a like, subscribe to my channel, share this video with someone you think it could help, and let me know down in the comments, have you had experiences with illegal cosmetic procedures? Have you had an experience with any of the procedures I mentioned earlier? What was your experience like? Do you know someone that had that experience? Do you know some stats in regards to like that goes in line with these procedures, in regards to like just any information? I would love to have a conversation going about this, because we don't talk about it enough and we see it everywhere. All right, so thank you so much for tuning to my channel, and I hope to see you in the next video. Bye.